hello everybody. It's so good to see so many of you here, and yeah, we've been putting in a lot of hard work, so I'm looking forward to giving you this update. So I've got quite a lot to cover today. I'm going to try and cover through all of these aspects. Everything from what we're trying to achieve, the question bank that we've put together, how we're going about refining and prioritizing the questions, which Karen's going to help with, and then on to the production and the editorial processes and some key messages. So the main question is really that we're finding is why now? And I think it's obvious that the world is facing a large-scale public health crisis, the likes of which we have not seen before, and this really is presenting a lot of gaps in knowledge, but we're recognizing that health experts and clinicians are having to make those decisions on a daily basis. There has been a rapid proliferation of research, which obviously creates an urgent need for evidence syntheses. And Cochrane is really well placed to respond to this due to its international collaborative groups, the reputation that we have in evidence synthesis, and our ability to update quickly, which is something that other organisations are learning to do, but we've been doing all along. Now, groups and fields were receiving a large number of requests from the beginning, really, and this was something that we knew we had to act quickly on to try and coordinate those efforts and to prevent duplication occurring, especially within Cochrane, but between Cochrane also and our partners. We've had a huge number of offers as well from Cochrane Groups and author teams to donate their time, and we realised that we needed to coordinate that centrally as well. So this was a slide I tried to put together to really just show how quickly everything is moving, and this shows, you know, from the 31st of December when we first heard about these cluster of cases in Wuhan. You know, within a month, the public health emergency of international concern had been declared by the WHO, and within a couple of weeks after that, they were holding a forum to define the research priorities and the research roadmap, as they were calling it. And really quite soon after that, the discussions began between Cochrane and the WHO. After the pandemic was declared on the 11th of March, it was very soon after that we really realized that we needed to collect these priority questions. And then it was by the 26th of March that we had a site in kind of its earliest sense launched to try and begin work on these priority reviews that were coming through. And then by the 8th and the 21st of March, we had the first 2 reviews published. And really, it's only now that we're managing to take a bit of a pause and to group the huge number of questions that have come through and to figure out what the next questions are that are the ones that we need to focus on, and how we work together with Cochrane Groups to make sure that those are done to a high standard and quickly. So this is our overall aim. We want to provide rapid, high-quality evidence syntheses to inform the important decisions being made by clinicians, policymakers, and the public during the coronavirus pandemic. And really, we saw that happening in 3 main ways. We wanted to coordinate with Cochrane, within Cochrane rather, and with our partners to prevent duplication of effort. We wanted to compile a list of priority questions that we were hearing about to show both what work is underway within Cochrane, but also the main areas that we know are ongoing elsewhere, and to help us direct our resources. And to provide clear methods guidance and offer a fast-track editorial support for the highest priority questions. And that's not to say that there won't be others, but in terms of those really important questions, making sure that they can be done as quickly as possible. So this is the website that's been launched, and the portal where everything is being held, and this is really the first port of call for anybody with wanting to learn more about what's going on. We've got various aspects on there, from the question bank, which is very much under development and is hopefully going to look quite different in the next week or so. There's some information about prioritization there and how to submit a question that isn't already on the list. There's information about process. Again, this is ongoing and being updated as we're defining things, and resources. So in terms of the protocol and everything else that's been put together, we'll hear about that in a second. So Karen, do you want to just take over for this bit?
Yes, thanks everyone. Thanks, Kaylee. So way back, as Kaylee says, way back in the olden days on the 17th of March, we started collecting the questions from a few key stakeholders, and that allowed us to prioritise a few topics to get the rapid review process rolling. And this started a period where quite quickly many questions came in from different places, and the questions grew from 10 to 250 in the period of 3 weeks. And that's when we launched the question bank. And of course, this is great in terms of engagement and having the information, but it created its own problems. We needed to do some housekeeping. And so the submission process is currently paused so that we can sort out the existing questions that we've got by topic, and to tag them, to duplicate them, and to quickly prioritize the questions for the future reviews. Do you want the next slide, please, Kaylee?
Yep.
Thanks. So the prioritization of review questions is a key issue, and we want to address as a priority the questions which are most important to healthcare workers, particularly those in low and middle income settings. But to be able to prioritize the questions, they need to make sense, and we need to make sure that we aren't duplicating the work being done elsewhere within Cochrane and in other organizations, and that's been a major challenge. So we're now looking at the tagged questions that we have in the question bank, and we'll be working with Cochrane stakeholders and the networks and external stakeholders over the next few weeks to pragmatically identify the next set of questions which should be prioritised, which will lead on to the production. Kaylee.
Thank you, Karen. Okay, so we've obviously had to try and figure out a process that would, or a production process and an editorial process that would make sense in these circumstances, and really the minimum that the things that we weren't willing to compromise on to make sure that we're still meeting a lot of the, we're not losing our gold standard. That was something that we knew we had to maintain through this. So what we're asking is that authors register in Prospero or in the Open Science Framework when they want to conduct a review, a Cochrane Rapid Review. This is because the process that normally occurs where a protocol would automatically trigger the Prospero record is not going to happen in that way for these titles, because they're not being registered in the usual sense. Now we are also asking for authors to complete the standard workflow, which we've put together to really think through their team composition. Everything that is normally at play for any Cochrane review is, I think, heightened for these. Everything that needs to happen very quickly. There's things like teams that are used to working together and have the resources that they need and the access to the software, etc., which we're trying to outline as much of that as possible. We're also asking that we're still doing protocols, so pre-specifying methods in the template, and we put quite a lot of effort into developing a protocol that would be both easy to fill in, but also make sure that it's capturing everything that it should be. And actually, there's a new version of the template that will be up very soon that hopefully does that in more detail. So we're not publishing the protocols in advance in the usual sense, but they are being submitted to us and dated and published as an appendix to the full review. They have been designed to meet the conduct and reporting standards highlighted by the Rapid Reviews Methods group, and that's what Chantel will be going into more detail with a bit later. So within the protocol, you'll see that there are certain methods or kind of recommendations already ticked, and that's to highlight where there was the most support from a survey that was done. So we recognise that this is not perfect, that it may require adaptation for some questions, particularly those looking at qualitative or diagnostic questions. Okay, so the review can be written up in the Word template that we've put together as well, and all reviews are being done in a flexible review format as things stand. And that has to be converted into a Redman file by the editorial team. This is all designed to speed things up. And then onto the editorial process. We have a few options here, and I think that this will hopefully allay some of the questions that we've been getting. So the first one is the fast track for questions that are identified as high priority. So as Karen was outlining, we're doing our best to try and pick out those and help to kind of rise to the top those very important questions that are coming through prioritization. For those questions, as they're identified, we're trying to have discussions with the relevant CRG to refine the question, because we're really noticing that, you know, the question that's put on the bank is not necessarily in PICO format or whatever it needs to be depending on the question, and to agree the capacity of who will be taking it on and leading it in an editorial sense. It's only for these particular fast track questions that we will have on-hand methodological support, either through the method support unit or in terms of Cochrane information specialists. The only way that these can be turned around in 2 weeks, which is, you know, you will all appreciate, I imagine, a pretty difficult task, is to have parallel processes and for quality assurance, peer review, and consumer review, and for copy editing. And we're aiming to publish those in 2 weeks. And I've got a slide in a second that shows that we're just about keeping to that at the moment. These will also be prioritized for updating as new evidence emerges. The second option really is a collaboration between EMD and CRGs, and those can either be for priority questions that are identified centrally or for those that are CRG specific priorities. The EMD can provide as much process and methods guidance, while, you know, especially while we're trying to get this properly defined in terms of the process, but they can be led or supported by the CRG depending on capacity. And the CRG can define their timelines in discussion with the author team. And the third process really is to capture everything else that, you know, all of the questions and the work that we're getting a lot of interest about, but for questions that are currently not, currently haven't been refined or prioritized. So we don't want to prevent that work from happening, and we don't want to hold things up while prioritization is underway. But we obviously can't commit to publishing those right from the beginning, and they won't be registered in that sense. So we are trying to mark them in development in the question bank to try and prevent duplication, and we'll be open to submissions, and we'll sort of consider submissions as long as these things are met. So as long as they're still prospectively registered, as long as they're prepared in the protocol and review templates that we've put together, and as long as they're conducted in accordance with the interim guidance that Chantel will be going through. So for these ones, we are aiming to provide high-level protocol feedback, but it really is having to be sort of high level because just due to capacity, and really they are subject to either rejection or major revisions, depending on the quality when they're submitted. We also recognise that the editorial decision that's made upon submission needs to be done with support of the CRG and their content expertise, with whichever CRG that falls under. So we have already published 3 reviews. So the second one here is not technically a rapid review, but it was done very rapidly as an update. So the quarantine review was turned around in 15 days from submission. The PP review, which has had a lot of interest, was just 16 days. And a qualitative evidence synthesis was turned around in 11 days. So kudos to the editorial team that managed to do that. I know it wasn't easy. And other examples in the pipeline I've put in here. So we've got one about ASH, we've got information and communication technology for social isolation, and a couple of DTA molecular tests, point of care tests, and antibody tests. Those will all be hopefully coming in about the next week. Okay, sorry about that. Okay, so we wanted to give some key messages here to a few different groups. So these for prospective authors really, as I've said already, the rapid process really does require a range of on-hand specialist methodological and content expertise, and we're really encouraging people to think that through in detail at the beginning, because we won't have the resources to support the reviews in the time that's required. And not all questions on the bank are going to be suitable for development as a rapid review, and we won't be able to get back to all teams do that. So please, if we don't know about it, please check for overlap in existing Cochrane reviews and conduct scoping searches to think about eligibility and how it can be best be done in the time. Submitting a question to the bank does not act as a title registration. I think that's important to stress, and we certainly won't be taking forward all of the questions as Cochrane Rapid Reviews. The bank is really just to show what work is underway and to try and prevent duplication. The method support and the speed of the editorial process will depend on whether the question has been identified as a priority, as I've already described. Key messages to groups and specifically CRGs is that if you're receiving proposals and you need any help, you can email that address. For now, I think that might change as things move on. If you're receiving those kind of proposals and you want to know what to do, it's useful for us to know whether it's on the question bank or a new question that you're proposing or have had proposed, the intention to pursue it as a standard or a rapid review, and whether you have the capacity to support the review and the editorial process. Each CRG really has to decide their own balance between your usual workload and your COVID-19 work, and that we recognise that will be different for every group. And you can let us know if you have any capacity that you want to help the central team to move things forward, and if your usual workload is affected by either by reduced capacity in the staff, in your own staff, or those that usually contribute to your reviews. Key messages for anyone wanting to get involved. The main one is please be patient. We are getting a huge amount of requests, and we are doing our best to get back to people as best as we can. But at the moment, the priority is working on the reviews that we know are the most important and getting those through as quickly as we can. But we are trying to direct people to Cochrane Task Exchange, which now has a filter for COVID-19 tasks. So I've listed here, and Chris assures me that these will be available on the website afterwards. So I've got some resources that might be useful. So things like the templates on our own website, updates about the wider Cochrane response to COVID-19, updates about rapid review development more generally, what's happening on the Cochrane Library, methods groups, etc. So those will all be available afterwards. And this last thing really is just to say that a huge number of people have been involved in this, and it really has been quite a team effort. So all of those people there, and there are many more, and I've had to put the COVID-19 working group there because there are some really key players in there that I couldn't name individually, but it's been incredible the amount of work that's already gone in, and there's still a lot more to do.